Hey everybody, it's Reagan Archibald with Integrated Pain Specialists, and today I'm going to help you get ready for your next visit. What the purpose of this video is designed for is to help you get ready as you go in to make a life-changing decision about getting real answers for your neuropathy. We're going to give you two options today. We're going to show you how you can just patch things up, or you can actually fix the underlying problem. First of all, neuropathy is quickly becoming one of the most common chronic diseases in the United States. About 8% of the United States population has this. 24 million people suffer from peripheral neuropathy. And this can be deteriorating not only to your quality of life, but also to your energy levels and having a better future for yourself. So if you suffer from any of these 7 warning signs, this is what we focused on in your initial visit. If you have numbness, if you have burning pain, if you have cramping, any sharp electrical pain, any prickling or tingling, any balance problems or falls, and then if you can't fall asleep because of foot pain, there's a good chance you have neuropathy. And with our examination, we were able to uncover some of the root causes around your conditions. Most of you have been given the option, let's take some Lyrica or gabapentin. Some of these medications may work temporarily, but it's not the solution. In our clinic, we always have this we jokingly say we've never found a single person to be Neurontin deficient or gabapentin deficient, but really what our goal is to treat the underlying cause without just prescribing more medication and more drugs. And so our approach is multi-pronged. Integrated pain specialists, we have medical management, we have chiropractors, we have interventional pain medicine, we have some of the leading doctors in the country who are experts in treating neuropathy. We have regenerative medicine, we have physical therapy, acupuncture, and chiropractic care, all working together as a team to get you the best possible outcome. When you come in for your visit, we'll be able to talk to you about the programs that we put together that are multifaceted, that are designed to get you out of pain as quickly as possible for as long term as possible. The way that we do that is we do a specific exam for you. It's called functional testing, and you may have seen this when you're in. We use what's called a microfilament in your test. We use vibration. We're discovering what your nerves are sensing and are not sensing. From this initial examination, what you'll find is every 30 days to 6 weeks, we're going to be doing a re-examination to see just how much progress we've made, and we actually graph that out for you. It's progress that we're looking for, not perfection. And so this is really important because when you come in, we only will accept you if we can get at least 50% of your symptoms gone. So imagine that you could get 50 to 100% of your symptoms gone. How many of you would say that would be life-changing? One of the things that we'll be presenting, if you're a candidate for this, is the neuromodulation. Now, this has been one of the biggest breakthroughs because with neuromodulation, we can actually put a device on you, and within 5 short days, you'll know if this will reduce your symptoms. It actually sends a signal to your brain so that your brain starts communicating to your feet in a normal way. It's similar to putting your phone or your computer on Wi-Fi, and I think we've all experienced that where we have a poor connection. That's exactly what's going on, is your brain in your feet or your brain in your hands aren't communicating very well. And so the neuromodulation or the spinal cord stimulator trial gives us a great opportunity to see if we can connect your nerves to your brain again. And there's phenomenal things that we found and discovered that have changed people's lives. It's very discreet. It's easy to implant. There's nothing permanent in this initial trial. And 85% of people who actually had this neuromodulation device put on them noticed that they had at least a 50% reduction in the neuropathic symptoms. So very important if you've got any of those 7 symptoms that we covered before. The second thing we're going to do is help your body heal from the inside out. What we do is we focus on getting the right supplements in your body. So we use a unique blend of CellCore products. Now, CellCore uses fulvic and humic acid and charged particles to actually bring nutrients into your cells in exchange for a toxin. So it's a way of detoxifying your body and your nerves and increasing your blood circulation. The second thing that we do to heal the body from the inside out is use novel peptides. So one of those is BPC-157 that's been proven to stimulate nitric oxide, circulation. The other peptide we use is called thymosin beta-4, and thymosin beta-4 actually stimulates the stem cells in your own body so your body can start to heal. and you'll have faster recovery in muscles, faster recovery in nerves from these supplements. The other way that we increase nitric oxide is we give you what's called the anodyne light therapy. So you actually put these laser lights on the bottom of your feet that was developed by NASA, and that stimulates better blood circulation, it stimulates nitric oxide, and you're going to start noticing that your body starts to recover and starts to repair. You're going to have an increase in blood flow, you're going to have a decrease in healing time, and then you're going to get what's called angiogenesis, or new blood growth, so blood vessel growth. So it's a really important part when it comes to complete care for neuropathy. The other thing we're going to do is give you a device called a rebuilder, and the rebuilder is this machine that just puts this gentle stimulation into the nerve pathways, so we're retraining the nerves on how to work again, and it's a magical thing. You may be recommended chiropractic care, physical therapy services, acupuncture. These can be all part of the overall program. And one of the most novel things we do is we use platelet-rich plasma treatments. So we actually inject PRP. PRP is a great way for activating your body's own regenerative properties. It's very important that you have the sequence of treatments, because that's how we're going to get the nerves to wake up. Some of you may need spinal decompression if you've got neuropathy that's related to low back pain specifically. Some of you may need what we call our pulse wave device, which sends nice electrical currents. Some of you may need laser. All these things will be really important to get you the results that you need. And then, we're going to give you the option, do you want complete care or conservative care? Complete care is where you get everything you're going to possibly need to get your body back in gear, whereas conservative care might be just doing kind of the minimum. And so we leave it up to you, but we're going to prescribe to you exactly what you're going to need when you come in for your next visit. So we believe results matter, and we've got multiple videos that we'll share with you when you're in. Some of you may need other pain procedures like a medial branch nerve block. We may do facet joint injections. We may even prescribe different things like an epidural or even a nerve reset, and that's called an RFA. So when you come in, we'll have an entire treatment plan ready for you, and we just want to make sure that you're ready for this. We appreciate the time you've spent watching this video and taking the time to come meet with us, and I hope this helps get you prepared for what I believe could be one of the most meaningful experiences of your life. Bring your spouse, your support person. They're going to want to be in on this, and we can't wait to see you in the clinic.